You stand up from the couch and the room tilts. Just for a second, maybe two. You grab the armrest. You wait. It passes. You keep walking. Or you get out of bed in the morning and your legs feel like they belong to someone else for the first 5 steps. You blink a few times. You hold the wall, and then it clears. And you never mention it to anyone. Or maybe it is after lunch. You have eaten a perfectly normal meal, and 30 minutes later you feel like someone unplugged you. Not sleepy exactly, more like drained, like the floor is slightly tilted and your head is full of wet cotton. If any of that sounds familiar, stay right here. Because what you have been calling just getting older has a name, it has a cause, and the research has been clear about it for over 30 years. In adults over 65, roughly 1 in 6 has a condition where their blood pressure drops significantly every single time they stand up. Over 75, it is closer to 1 in 3. And in most cases, nobody has ever checked for it. Every visit, they wrap that cuff around your arm. They check the number. They tell you it is fine, or they adjust your medication, and then they send you home. But here is what they almost never do. They almost never check what happens to that number when you stand up. Every week on Inside Aging, we go through the blood pressure research the 15-minute appointment never leaves room for, including the readings your doctor was never trained to look for. That is the gap this video fills. Now here is what shocked researchers. The medical system has spent decades and billions of dollars building an entire infrastructure around high blood pressure, screening programs, medication guidelines, public awareness campaigns, and for good reason. High blood pressure is dangerous. But when they went looking at the flip side, they found something almost nobody had been measuring. Low blood pressure in older adults is not the opposite of a problem. It is a different problem, and in many cases, it is more immediately dangerous. A blood pressure reading that is too high might cause damage over years. A blood pressure reading that drops too low when you stand up can put you on the floor in seconds. The condition is called orthostatic hypotension, and the after-meal version is called postprandial hypotension. Together they affect between 16 and 40% of adults over 65. And here is where it gets uncomfortable. A 2025 clinical audit looked at hospital wards specifically treating patients who had already fallen, patients who had already broken a bone, and staff were still not consistently checking lying to standing blood pressure, the one test that would explain why the fall happened. That is not a gap. That is a blind spot. If this is already making you think of someone, a parent, a spouse, a friend who has been dizzy in the mornings or unsteady after meals, hit that like button right now. When you do, YouTube shows this video to thousands of other people over 60 who are dealing with the same thing quietly. You could be the reason someone's mother finally gets the test she should have had years ago. Now, before we go any further, we want you to find out where you stand. Literally. This is the Lie to Stand blood pressure test. You will need a home blood pressure monitor, the arm cuff kind, not a wrist monitor. Step 1. Lie down flat for 5 minutes. Then take your blood pressure while you are still lying down. Write down the top number. Step 2. Stand up. Wait exactly 1 minute. Take your blood pressure again while standing. Write down that top number too. Step 3. Subtract the standing number from the lying down number. That is your drop. If your drop is less than 10, that number falls in the range researchers consider normal. If it is between 10 and 19, it is in the borderline range and worth watching. If it is 20 or more, that meets the clinical definition of orthostatic hypotension. Bring that number to your doctor. Write your drop in the comments right now. At the end of this video, we are going to give you a protocol. Follow it for 14 days, then come back and post your new number. The research suggests it can change. So what is actually happening inside your body when you stand up? Think of it this way. When you are lying down, your blood is distributed fairly evenly. The moment you stand, gravity pulls somewhere between 500 and 700 milliliters of blood, roughly 1.5 pints, downward into your legs and abdomen. In a younger person, the body catches this instantly. Sensors in the neck and chest detect the drop within a heartbeat. They tell the brain to speed up the heart and tighten the blood vessels. Pressure is restored before you ever notice anything happened. After 60, those sensors slow down. They do not fire as quickly, and the heart, which is also aging, cannot accelerate the way it used to. So for a few seconds, sometimes longer, the brain is not getting enough blood. That is the dizziness. That is the grey out. That is the moment you grab the wall. And there is a second version that happens after meals. When you eat, the body diverts a massive amount of blood to the digestive system. In a younger person, other blood vessels tighten to compensate, but in an older person with stiff arteries, that compensation fails. Now here is what nobody expected. In one study of postprandial hypotension, 96% of the episodes produced no symptoms at all. No dizziness, no warning, just a pressure drop that went completely undetected. Which brings us to where most people get this completely wrong. They assume low blood pressure is the opposite of high blood pressure, that if high is dangerous, low must be safe. Some people even think low blood pressure is a sign of a healthy heart. But the real villain in this story is not low blood pressure by itself. It is the drop, the swing, the moment when the pressure is adequate in one position and inadequate in another, and the difference is never measured. And in many cases, the thing creating that swing is the very medication the doctor prescribed to keep the patient safe. We will get to that. But first, consider a case that shows up again and again in the research literature, a composite drawn from published clinical cases, so nothing here identifies a single real person. A woman we will call Margaret, 71, retired teacher, still sharp, still driving, still hosting Sunday dinners. She had been on blood pressure medication for 12 years, lisinopril and amlodipine, and at every checkup, her doctor told her the same thing. "Your numbers look great, Margaret." Her sitting blood pressure was usually around 126/74. Textbook. But Margaret had noticed something she never mentioned. In the mornings, when she got out of bed, the room would swim for a few seconds. She would stand at the edge of the bed, hand on the nightstand, and wait for it to settle. She had been doing this for 2 years. She figured it was just part of being 71. One Tuesday morning in November, she got up to use the bathroom. She stood up faster than usual. The room did not just swim, it went dark. 2 seconds of nothing, and she went down. Hip fracture, surgery, 3 weeks of rehabilitation, and during those 3 weeks of limited movement, her muscles lost enough mass to shift her balance permanently. She went from hosting Sunday dinners to needing a walker. When the rehabilitation team finally checked her lying to standing blood pressure, the test that had not been done in 12 years, her drop was 38 millimeters of mercury. Classic orthostatic hypotension, driven, at least in part, by the combination of medications managing her seated blood pressure perfectly while leaving her standing blood pressure dangerously low. Margaret did not fall because her bones were weak. Margaret fell because her blood pressure dropped, and the difference had never been measured. Now, before we walk through the 5 hidden consequences, let us clear a few things most people have been told that the research does not support. Myth: if your seated blood pressure is normal, your blood pressure is under control. Not true. Seated pressure and standing pressure can differ by 30 points or more, and only one of them is measured at most appointments. Standing pressure is the one that determines whether you land in the emergency room after a trip to the kitchen. Myth: low blood pressure means the medication is working. The opposite is often true. In older adults, blood pressure lowered too far by medication has been directly associated with faster cognitive decline and higher fall rates. Working is not the same as safe. Myth: if the medication was right 5 years ago, it is right now. Not quite. Bodies change with age. Arteries stiffen. Kidneys process drugs differently. What was the correct dose at 65 may be too much at 70. Doses are meant to be reviewed, not set once and forgotten. Here is what that means for you specifically. 5 hidden consequences of low blood pressure nobody warns you about after 65. And number 1 is the finding that changes everything about how you think about every dizzy morning you have ever had. Number 5, the fall that everyone blames on tripping. When an older adult falls, the first thing people say is, "She tripped," or "He lost his balance." Sometimes that is true, but in a significant number of cases, what actually happened is that blood pressure dropped, the brain briefly lost adequate perfusion, and the person went down before they could catch themselves. You know the moment. You stood up from a chair. You turned a corner. You reached for something on a shelf, and your body did not keep up with the position change. That is not even the dangerous part. Here is what is. Hip fractures resulting from falls are associated with a 5-fold increase in 1-year mortality for adults over 60. Not a 50% increase, a 500% increase. In nursing home patients, hip fracture mortality at 1 year exceeds 40%. That fall was not a random accident. It started with a blood pressure swing that is measurable and in many cases preventable. Number 4, the blackout you explained away. Maybe it lasted half a second. Maybe you did not even hit the ground. You just caught yourself on the counter. You might have told your spouse about it. You probably did not tell your doctor. That is syncope, a momentary loss of consciousness caused by the brain receiving inadequate blood flow. In older adults, orthostatic and postprandial blood pressure drops are among the most common causes and one of the most frequently missed. Then researchers discovered something nobody expected. In older adults with dementia, fainting episodes were being routinely attributed to the dementia itself. But when the numbers were actually checked, many of those episodes were caused by orthostatic hypotension driven by blood pressure medication, a treatable blood pressure problem misread as inevitable cognitive decline. 5 years from now, the people who noticed the near blackouts and asked the right question will be the ones still walking without a walker. The people who explained them away will be the ones whose families are trying to reconstruct what happened, sitting beside a hospital bed. The difference between a near blackout and a full blackout is luck, and the distance between you and the nearest hard surface. Number 3, the afternoon fog you keep blaming on lunch. You have eaten a sandwich, some soup, nothing unusual, and an hour later you are sitting in your chair, and you feel like someone dimmed the lights inside your head. Not quite sleepy, not quite awake. You cannot concentrate. If you stand up to clear the dishes, you might feel slightly off balance. Most people call this a food coma. Here is what it actually is. Blood is pooling in the digestive system, and the brain is running on less supply than it needs. Systolic pressure may have dropped 20 or 30 points from where it was before the meal. And because this happens while you are sitting down, not standing up, a routine visit would never catch it. Consider a man we will call Richard, retired accountant, 68. Every afternoon around 2 p.m., he would sink into his recliner and doze for 45 minutes. His wife assumed he was just tired. His doctor assumed he was just aging. When a new physician finally ran a postprandial blood pressure check, sitting reading before lunch, sitting reading 40 minutes after, the difference was 24 points. Richard was not tired. Richard was underperfused. A smaller lunch and a glass of water before eating brought back most of his afternoons. It is not a food coma, it is a blood pressure event. Number 2. The medication that may be pushing you too low. Here is where people get blindsided. You are taking blood pressure medication because your doctor said your pressure was too high. The medication works. Your numbers come down. Your doctor is pleased. But here is the question that rarely gets asked. Did the medication bring your pressure down too far when you are upright and active, even if it looks fine when you are sitting in the office? Let us be clear. Blood pressure medications save lives. They prevent strokes. They protect hearts. The issue is not the drugs themselves. It is when the dose no longer matches the body it is treating. Bodies change with age. What was the right dose 5 years ago may be too much today. The research on this is uncomfortable. In older adults on blood pressure medication, those whose daytime systolic pressure dropped below 128 showed significantly faster cognitive decline, and starting new blood pressure medication in older adults was associated with an 80% higher risk of serious falls requiring hospitalization. Not because the medication was wrong, because the body's ability to compensate for the pressure change was not accounted for. So if you are on blood pressure medication and you have been feeling dizzy when you stand up, or foggy after meals, or unsteady on your feet, please talk to your doctor. Not to stop your medication, to ask whether the dose still fits. Consult your doctor before changing anything about how you take these drugs. That single conversation could change how your next 12 months feel. And number one, the one that changes everything, your brain. Imagine your brain receiving slightly less oxygen every single morning for 10 years. Not enough to cause a stroke, not enough for anyone to notice. Just a small reduction every time you stand up, every time you finish a meal, every time you get out of bed at 3 in the morning to use the bathroom. 10 years of that, quietly reducing the oxygen supply to the tissue that keeps you sharp, keeps you remembering, keeps you being who you are. That is not a hypothetical. That is what the research describes. The Bronx Aging Study followed over 400 adults, aged 75 and older, for up to 21 years. For every 10-point drop in diastolic blood pressure, the risk of developing dementia increased by 20%, and the risk of Alzheimer's disease specifically was significantly elevated. Then a separate study followed more than 24,000 people for up to 27 years. Same finding. Low blood pressure was a significant predictor of both cognitive decline and dementia, independent of age, weight, diabetes, or kidney disease. The dizziness you have been ignoring is not an inconvenience. The fog after lunch is not a quirk of aging. The unsteadiness in the morning is not something you should just get used to. Those are signals that the brain is not getting the blood it needs, and the consequences accumulate over time. The test exists. It takes 2 minutes. For millions of people over 65, it has simply never been done. How old are you right now? Write your age in the comments, because everything just described becomes more likely with every year after 60, and the earlier you catch it, the more you can do about it. Write your age. It helps us understand who this is reaching. Now here is what you can do about it. This is the Standing Safe Protocol. 6 steps, all evidence-backed, all built around the number you wrote down earlier. Step 1. The water bolus. First thing in the morning, and 15 to 20 minutes before any time you know you will be standing for a while, drink 16 ounces of water. About 2 full glasses, consumed within 5 minutes. In older adults with orthostatic hypotension, this single action improved standing blood pressure by an average of 12 points and worked in 56% of patients tested, the most effective non-drug intervention available. Step 2. The edge of bed rule. Never go from lying flat to standing in one motion. Sit at the edge of the bed for at least 60 seconds. Clench your fists a few times. Pump your ankles up and down. Give the blood vessels time to catch up with gravity. Step 3. The counter maneuver. If you feel dizzy while standing, do not just freeze and hope it passes. Cross your legs and squeeze your thigh muscles together, or clench your fists tightly and hold for 10 seconds. These push blood back up toward the brain. No equipment. Can be done anywhere without anyone noticing. Step 4. Smaller meals, fewer carbs. Large meals, especially high carbohydrate meals, are the single biggest trigger for after-meal blood pressure drops. Eat smaller, more frequent meals. Reduce the bread, pasta, rice, and potatoes at any single sitting. Drink a large glass of water before you eat. Step 5. Move more, fragment less. Older adults with the most fragmented activity patterns, short bursts with long sedentary stretches, had over 5 times the risk of developing orthostatic hypotension compared with those who moved in longer sustained bouts. Regular walking, gentle strength training, anything that keeps blood moving through the legs. Step 6. Ask your doctor for the lying to standing test. This is the most important step. Bring your home test result to your next appointment. Ask your doctor to check your blood pressure lying down, then at 1 minute and 3 minutes after standing. Ask whether your current medications could be contributing to a drop. Ask whether the dose needs to be reviewed. Safely reducing blood pressure medication in older adults has been shown to be sustainable for 4 years in more than half of those who try it, with no evidence of harm. Sometimes the right adjustment means safer days on your feet. Consult your doctor before changing anything. One more thing to discuss with your doctor. If you have not had your kidney function and electrolytes checked recently, ask for a basic metabolic panel. Dehydration and electrolyte imbalances, extremely common in older adults, can silently worsen blood pressure drops. This is not a recommendation. It is a conversation worth having with someone who knows your full medical history. If you did the lie to stand test earlier, you have a number now. That number belongs to you. Follow the standing safe protocol for 14 days, then test again. And come back to this video and post your new number in the comments. Because the dizziness was never just aging, the fog was never just a big lunch, and the fall that changes a life always starts with something that could have been caught. Every week on Inside Aging, we go through research like this, findings that sit in medical journals for years before anyone bothers to translate them into plain language for the people they matter to most. If you want that kind of information in your feed, instead of buried in an academic database, subscribe now and hit the bell. It is the only way YouTube guarantees you will see the next one. And if someone you love has been dizzy in the mornings or unsteady after meals, or has had a fall that nobody could explain, send them this video right now. You cannot go back and give them the test they should have had, but you can make sure they get it today.